you're not going to fully heal them until you fix the diabetes. It's like another spot comes out, you're going to try to heal it, but if you don't fix the problem, you're never going to catch up. Okay, but it will heal it. But you get ulcers very easy. You go blind. You know why you go blind? When your blood sugar is high, it stimulates blood vessel growth, and blood vessel growth grows right across your eye, just like you put a finger in your eyes, and you can't reverse that. There is no burning laser they can do to heal that. You can't stop it. It's a response the body does to high sugar levels. Okay, if you have high sugar levels, you go blind with diabetes because it grows right across the back of the eye, and there's no fixing it. There's no transplant. There's nothing you can do. And they wouldn't give you a transplant because they can't do surgery because your blood sugar's high. Okay? Does this make sense to you? It's a serious problem when your blood sugar's high. I had a patient come in, Ed, that was a police officer, got mandatory retirement because of his diabetes. And back then I didn't know much about it. I wasn't doing hardly any nutrition work. Just a little reflex stuff, and I didn't even know what I was doing back then. Okay? Still help people. But he came in, and they were laughing at me and stuff, and because I took an x-ray, and because of diabetes, he couldn't perform as a man anymore. And he was the first patient I ever had that had one of those surgeries where they put a crane in, and on an x-ray it looked scary. Freaked me out. I didn't know what it was. I said, "You swallowed a train." You know, and she laughed. His wife, "Oh no, it's one of these things. You want to see?" And I said, "No, I don't need to see." But they told me there's just a little pump. You pump it up, and if he makes me mad, I flip the switch, and I don't have to deal with him. Okay? I said, "Okay." We laughed. I adjusted him. 3 months later, he rolls back in the door. He must have lost 60 pounds. He was blind. It's just 3 months, maybe 4. And he walks in like this. She's having to guide him. And I'm sitting there adjusting with tears going down my face because, I mean, I watched the guy deteriorate before my eyes. And 3 months after that, he was dead. And I couldn't have helped him at that point. He had gone so far downhill, I couldn't have helped him. Like my dog, Monty, my Maltese, he started having bad breath, and I thought, he's only 7 years old. What could happen, right? When I finally got around to taking him to the vet, we started putting him on injections. His blood sugar was crazy. He just shut down and started going bathroom everywhere. We had to put him down within 4 weeks. Had to put him down. Diabetes is serious. Anybody here not have a relative that's got diabetes? Anybody? I mean, I do. I'm just waving my hand. It's rampant. I had a lady the other week that didn't have anybody that has diabetes at all. I said, okay, that's unusual. Nowadays, it's almost like, I mean, my mother-in-law, my sister-in-law has diabetes. My side of the family actually doesn't have any, but my wife's side has a bunch, okay? My wife does not have diabetes. She doesn't like sugars much, okay? And a little beer or wine, you know, that acts the same. You're going to see this. They're all the same. Sugar, wine, alcohol, any of these simple carbohydrates are going to affect you just like the same, okay? And alcohol even stronger because it's twice as strong as sugars almost. So we all agree high sugar levels are bad, okay? And we don't want to see it. So here's what we do. When the sugar level gets high, the body secretes insulin. What does insulin do? It comes up, it grabs that sugar, and it takes it down to a normal level. We go back, we eat some more crispy bars, right? And angel food cake and stuff, and it goes up. Actually, an apple has more sugar than angel food cake. Did you know that? Fruit aren't as good for you as you guys think, okay? Well, but I just do berries. You get hit by a Mack truck, you get hit by a Volkswagen. One's going to kill you, one's going to hurt you pretty bad, okay? I mean, okay, it's not as bad, but it's still too much sugar. All right, so this is what's going on. Your body is going, oh my goodness, is he or she ever going to stop eating sugar? I'm working my butt off. After a while, what happens? Okay, it's bringing the sugar down, bringing the sugar down. We're going to talk about what happens during all this. But after a while, the pancreas gets wore out and starts to do this. It starts to oversecrete insulin, and it brings your blood sugar too low. And what do they call that? Hypoglycemia. Thank you very much. Hypoglycemia, which is called pre-diabetic, right? So some people don't even know that. They just said, well, my doctor said I'm pre-diabetic. Good. Good. So you ready to fix it? Well, he said I'm not diabetic yet. I don't have to worry about it until I'm diabetic. That's wisdom, okay? So what happens is, if you keep going on and it oversecretes insulin, now the pancreas is really getting wore out. And eventually what happens to the pancreas? And now you got the same problem Ed had. Now Ed was type 1 diabetic, okay? There's 2 types. Type 1 and type 2. Type 1 are unfortunate patients. Ed was a very unfortunate patient. He got destroyed either from a vaccine or a parasitic infection or something attacked the pancreas, okay? And destroyed it. If the pancreas is gone, I can't help him. It's gone, okay? My friend Dr. Swan is a chiropractor in town over in Eastridge, and he went to University of Florida, Gators. I'm a Gator hater. He went there and they said, oh, you can't go to class, you got to get a measles vaccine. He goes, gets a measles vaccine, the next morning he's a diabetic type 1. He's furious. He goes back and says, you caused me to be a diabetic. They said, oh, that had nothing to do with it. Really? The only fact that was different in the last 24 hours is you gave me that stupid vaccine. I'm not trying to slam vaccines, this isn't the workshop for that. What I'm saying is, certain ones when you're older, there's ways to get around those nowadays. You just got to know how to do it. You know, and Steve had attacked his pancreas. Would it have done it to everybody? I don't know. But that's a friend of mine that testifies to it. He has to wear a pump, a constant pump to pump insulin for him because he has no pancreas. You know, and it shortens your life expectancy, so he works out very diligently, trying to keep and extend his life where it should have been. Okay, that's tough. That's type 1. Those are unfortunate patients. Type 2, that is misbehaved patients. We do it to ourselves. We don't mean to. Nobody wants to be diabetic, right? We don't want it, but we do it to ourselves. Take responsibility. It's okay. It's water under the bridge. It's gone. Okay? It's gone. But let's go ahead and move forward. Okay? Once we identify it and you decide that you want to make a change, let's make a change. Let's heal it. Let's talk about tonight how to heal this once and for all. Okay? You can reverse type 2. You don't have to be a diabetic. Okay? In fact, I'm going to tell you this. This isn't just a guarantee, this is just a fact. If you eat the way I tell you to eat tonight, and do what I tell you to do, if you're on high blood pressure meds, if you're on diabetic medications, you're going to have to get off them in the first 2 weeks. Most likely. And I can't do that. I'm a chiropractor and a physical therapist. I can't take you off of medication because I can't prescribe a medication. So, you need to tell your MD that, hey, listen, I'm going on this diet, and this big crazy guy says, I may not need this anymore, I've been doing it for 20 years. Okay? But if my blood sugar goes low because I don't need the insulin, should I cut it back? Well, they'll say yes. They'll say if you start feeling like you're lightheaded or passing out, call me and we'll have you cut it back or get off of it. Okay. Now, you would think more MDs would send clients to me in town. Hardly ever. It happens some. Hardly. I had one of the physicians, walk-in clinics, call me yesterday and I was busy with clients. 2 hours later, I called back. They said, oh, we sent them to somebody else. Ain't nobody else doing what I'm doing. But that's okay. I'm like, okay, well, thanks. I told you I'd call you back when I had a minute. I didn't have a minute till now. No big deal. But it's like when they saw one client, they go, oh, that's interesting, and they just go on. Do what they're taught to do. They're not taught much nutrition in medical school. They're taught pharmacology, because that's what they have to deal with, and they have to know it. They have to know all the drug interactions and stuff, nothing against them. But we want to get people well. And the way you do that is by what you eat. That's the big key. What we're going to do, let me show you exactly every side effect of insulin, so you guys fully understand what it is. The first thing insulin does, insulin takes blood sugar and it takes it out of the blood. Okay? That's a good thing, right? If you cause your blood sugar to go high by eating the wrong foods or high glycemic foods, and your blood sugar goes up, you got to get it down. We've already talked about that. You can't leave it high. What's the second thing insulin does? It takes that blood sugar and it sticks it in the fat cells. That's where it goes. Fat cell. That's where that's where your sugar goes, gang. It takes it and it sticks it right here, right here, oh, right here, oh, right here. This is where people say right here. Keeps going, right? Okay? That's where it sticks it. That's how we get fat. I was a fat kid, okay? I lived to eat when I was a kid. I just loved to eat. I still love to eat. I like to eat. I'm not ashamed of that. And I'm fine if I eat the right foods. I'm cool with that. In fact, when I eat right foods, I don't eat so much. It almost makes me mad to go to a buffet now. I used to be able to put 4 full plates away. And now I'm at a plate and a half and maybe a cup of soup, okay? Just by eating the right foods, your stomach changes, you know. That's number 2, is it takes the blood sugar out of the blood and it shoves it in the fat cells. Here's number 3. This is the kick in the head. This is the problem with the other diets. Third thing that insulin does is it makes the fat stay in the fat cells. All right, I'm going to put a red star by that. Isn't that a kick in the head? Now here you are busting your butt, spending all that money on HCG clinics and 500 calorie a day diets. You feel emaciated, you feel tired, you can't sleep, you're feeling horrible, and Dr. Shawn, you're saying that when I do Nutrisystem, or I do these things, and I eat fruit, or if I eat brownies or cookies or cakes, any diet that gives you sugar releases insulin. What does insulin do? It makes the fat stay in the cell. That's a kick in the head. You can't get out. It's like there's a force field around it. If you have insulin floating through your blood, you can't get it out. That's a fact. You don't have to believe me. It's in Guyton's Physiology. Look it up. That's a big side effect of insulin. Now there's another side effect of insulin. So we're going to talk about high blood pressure. It's all related to the same thing, right? What does it do? The fourth thing that insulin does is it makes your kidneys, it makes them retain or keep salts. See, gang, salt isn't bad for you. This is what salt should look like. It should look like dirty sand. That's real salt. They call it real salt. It's a brand. They mine it from the salt mines out in Utah. It should look like dirty sand. It shouldn't be bleached all pretty and white and no little specks of stuff in it. It shouldn't taste pungent and chlorinated. That's what real salt, that's what other salt is. Morton's and stuff like that, there's no nutritional value. They spray iodine in it to make you think you're getting your iodine and nutrition. It's just a smoke screen. It's not real. In fact, if you eat real salt and your doctor says you can't eat salt, yes you can. In fact, on our diet, I forget to say this, that's why I put this here to remind me, you have to have about a half a teaspoon of salt a day after about 4 or 5 days on our diet, because you're going to drop your salts. Let me show you. So, kidneys retain salts. And what does that do? If you retain salts in the kidneys, it increases your osmotic pressure. They call it osmotic pressure. Now, what is osmotic pressure? I don't know why. I got a neighbor that was a Hickson High School science teacher or junior high, and he did this, but evidently most science teachers don't. They get these acrylic big containers, and they put a semi-permeable membrane, which is pig gut, in the middle of it. You guys ever seen this experiment? Oh, it's so cool. It really is. And they put these containers there, and they fill water equal amounts on both sides. Water can move freely from side to side. That's what a semi-permeable membrane means, is water can get through because H2O molecules are small. But solutes can't get through. A solute is whatever dissolves in water or alcohol, like salt and sugar in this case. So they take 2 cups of salt and they dump it on one side of one container. He goes to the next container and takes 2 cups of sugar, dumps it on one side. He goes to the third container and takes 2 cups of sand, clean sand, and puts it on the other side, on the third container. And he walks around the class, starts lecturing about osmotic pressure all hour. And we're all sitting there going, oh yeah, okay, yeah. And at the end of the class, this is what's so cool. So you can look this up on YouTube. And then the class says, okay class, wake up and turn around. And we're all like, oh, whatever. And we turn around and look, we go, because what happened to the salt side? The water's way up here, and the water's down here, and we're going, wait a minute, what happened to the sugar side? Same thing. And we're like, how can that happen? There's atmospheric pressure. You talked about it all hour, how it pushes down equally on both sides. How can one side go up and one side go down? It doesn't make any sense, does it? What happened on the sand side? Nada. Because sand's a solid. It's not a solute. It doesn't dissolve into water. Some of Newton's laws are, everything goes from, in physics, everything goes from a lesser concentration to a greater concentration, or water moves from a lesser to a greater. And that's what happens. And that force is so strong, it will push across membranes and shove up pressure. And what happens? You get high blood pressure, ladies. This is what causes high blood pressure. Yeah, there's other things. You get adjusted, it'll drop 20 points. Yeah, if you take a diuretic, you keep urinating so much, you're going to decrease the volume of blood, but you got to keep drinking because it's going in one end and out the other, right? Yeah, you can take a beta blocker. Does that make any sense? Taking a beta blocker so your heart can't fully contract, and the fluid has to go somewhere, so if it can't push all the fluid out, where does it go? It backs up to your lungs, and you're always sounding like when you breathe, right? People on beta blockers, they get lung congestion all the time, okay? Yeah, those things will lower pressure artificially, but is it the real answer? No. If you eat right, you'll be off your blood pressure meds within 2 weeks. Almost guarantee it. I can't, if you have an adrenal kidney tumor, maybe not, okay, or something weird, But otherwise, normal people will be off it. I just warn people, look, it's up to you. I don't take you on or off medications. I just warn you. You're going to pass out if you take your medication, if you follow what I tell you to do. Why? Because they retain salts, and osmotic pressure goes up, and you keep all these fluids. You know what I'm talking about, ladies, right? You guys can all touch each other and see. The puffiness, right? We all get puffiness in the hands, arms. A lot of women can't get their rings on and off certain times of the month at least, if not all the time, right? And some people don't get the rings off because they can't get them off anymore. They haven't had them off in years. They couldn't possibly get them off without really working it really hard or doing something to decrease the fluid in their hand, right? So that's what happens with the kidneys, okay? All caused by insulin, which is caused by the pancreas. So bear with me here. Let's get a little crazy. Why don't we just do this? Why don't we eat in a way that doesn't stimulate insulin? Because let's eat something that doesn't make the pancreas, let's just shut the pancreas down. Let's put it to sleep. Okay? Let's just put it to sleep. Let's hibernate it just like a bear hibernates. So let's take your pancreas and put it to sleep. How do we do that? How about we eat low glycemic foods, which you have a list of there? Salads, vegetables, and meats. So what do we not eat? No fruits, no breads, no grains, no nuts, no starches. Now look, can you get away with a few nuts?